Actions speak louder than words, Tánaiste. We're now entering another winter period. The flaws in our public health services are being cruelly exposed. If we have a flu epidemic, the situation will be catastrophic. I know you're going to quote the figures for extra funding, in particular the £2.9 billion for capital investment on infrastructure, additional beds, equipment and mental health. That's over a 10-year period. I put it to you, Tánaiste, that this is not a solution. It is a sticking plaster, and it will barely maintain existing levels of care given demographic factors. That level of investment was called for in the Oireachtas report, but was crucially linked to a £3 billion special fund to deliver on Sláintecare over a 6-year period. There is no mention of this special implementation fund in the health budget of 2018 or 19, and in fact a mere £20 million has been allocated for 2019 to be ring-fenced for the Sláintecare integration programme. I put it to you that despite the statements to the contrary, despite the appointment of Laura McGahey, who I believe is a very professional health professional, to oversee the implementation programme, officials at a high level in the Department of Health are in reality in charge of the process and will ensure, in effect, that Sláintecare, if not quietly parked, will never be implemented as envisioned in the all-party Oireachtas report. Actions speak louder than words, Tánaiste. The Government Sláintecare implementation strategy outlined earlier this year, while making all the right noises, is a step back from the Oireachtas report in terms of timelines and funding. There is no commitment to universal access. That is, expanding eligibility still means testing. It's the opposite of universal access. You probably don't understand what universalism is or don't want to. So, Tánaiste, would you agree, in short, that real political commitment and funding is simply not there? And that means a continuation of a broken, not fit-for-purpose system which fails to deliver the service for the people that they deserve, and which also means a commitment, a continuation of the enormously stressful and poor working conditions of those working in our health service, particularly on the front line that we were talking about earlier on.